My name is Dr. June Kim. I am a Mohs surgeon at Cascade Eye and Skin Center, and I have been a Mohs surgeon for approximately 13 years. Well, Mohs surgery is a highly specialized tissue-sparing procedure for the removal of skin cancer. It was developed in the 1930s by Dr. Frederick Mohs. It is now the treatment of choice for most skin cancers on the head and neck, as well as for recurrent or aggressive skin cancers. It involves a series of steps to achieve a cancer-free margin while saving as much of your normal skin as possible. It is a specialized training process to become a Mohs surgeon, and we perform the procedure effectively. The Mohs surgeons at Cascade Eye and Skin Center are fellowship trained and board-certified skin cancer and reconstructive surgeons. While skin cancer is mainly caused by overexposure to sunlight, sunlight contains damaging ultraviolet rays. It penetrates through our epidermis and damages the DNA in our skin cells. And over time, this leads to skin cancer. Sun damage is the most common cause of basal cell carcinoma and squamous cell carcinomas, the two most common skin cancers we treat with Mohs surgery. Skin cancer is the most common form of cancer in the United States. Mohs surgery is used for higher risk skin cancers. Difficult areas such as the eyes, the nose, lips, eyes, or other parts of the face, particularly when we need to try and preserve as much skin as possible. There are also more aggressive type of skin cancers we treat. Those are noted on pathology reports, and it may indicate root under the skin, which we cannot see by simply looking at the surface. By using microscopic control, this allows us to accurately map out and remove all the tumor cells. Mohs surgery is highly effective. It's the gold standard for many high-risk skin cancers, and most Mohs surgeries have a 99% success rate. But it's not just the cure rate. It's because we can take less skin, we can create smaller wounds and potentially minimize scarring. Well, this is performed as an outpatient procedure on site in our Mohs surgery suite. If you need it, please bring a driver with you. You may also bring family or friends. It may be relaxing to have company while you're waiting. The procedure can take anywhere from 2 to 6 hours. It is advisable to reserve the whole day for the procedure. We suggest you bring a book, a phone, or a tablet to entertain you during the wait. After you enter the suite, the area will be identified and marked. The skin is prepared with an antiseptic skin cleanser. You will be awake during the procedure, so local anesthesia will be injected to comfortably numb up the surgical site. We will need to make sure and maintain the layer's orientation relative to the surgical site, and this is maintained throughout the entire procedure. We will use cautery to stop any bleeding during the surgery. The patient will get a temporary bandage placed on the wound, and you will wait comfortably in your own private room. The tissue will then be taken to our on-site histology lab, and it will be processed by our Mohs trained histotechnician. Once the slides are prepared, I will review the slides under the microscope for any signs of cancer at the margins. If any residual tumor is found, it is marked precisely on our map, and a second Mohs layer is taken, only in the positive areas. The process is repeated until all the margins are free of tumor. Although there are exceptions, most tumors only require 1 to 3 stages for complete removal. Well, once the cancer is completely removed, there are different methods to reconstruct the defect. If it's small and shallow, sometimes it can be left to heal by itself. Most defects are closed in a linear fashion, and in some circumstances, more extensive surgery may be necessary to repair the wound, and this may include a flap or a graft. Mohs surgeons may sometimes partner with another surgical specialist to close the wound. Now remember, there will be 2 layers of stitches to close this defect. There will be dissolving buried sutures on the bottom, and we will finish with some non-dissolvable sutures on top. The post-op wound instructions will be provided to you by the nursing team. The Mohs surgery will leave one of the smallest possible surgical defect and result in scar. Well, you will be provided with detailed instructions at the end of your visit. Now, it is common to experience some small amount of bruising, swelling, and bleeding around the wound. But if any of these are severe, please call us immediately. Now, most people report minimal pain after the surgery. Usually this responds readily to Tylenol. You will have a pressure bandage, and we advise that you do not get this wet for 48 hours. Your sutures will generally need to be removed in 7 to 14 days. We also advise that you do not consume alcohol for 48 hours. You will need to rest to heal properly. Please no exercise or heavy lifting for a week on average.